I'm going to talk about a couple of pelvic floor conditions, and then Dr. Ferguson will join us to talk about a few additional conditions. First of all, what are pelvic floor disorders? Probably the most common conditions that we see are urinary incontinence, pelvic organ prolapse, fecal incontinence, and constipation. Incontinence is incredibly common, so anyone who's experiencing it, you're definitely not alone. It affects over 25 million American adults, and more than half of these adults are women. So over 50% of women who leak don't actually seek medical treatment. Why is that? Well, embarrassment, that's an obvious one. People feel depressed about it. They think that nothing can be done about it, or they think it's a normal part of aging. So risk factors for urinary incontinence, and keep in mind that you can have urinary incontinence even if you have none of these risk factors, okay? The common risk factors are anything that leads to weakening of pelvic support structures, which can include genetics, pregnancy and childbirth, obesity, and things like neurologic diseases. So what is stress incontinence? So stress incontinence is leakage of urine during any activity that increases the pressure inside your belly. So that's leakage when you cough, sneeze, laugh, lift. So urgency incontinence is the other most common type of incontinence. And this is urinary leakage associated with a sensation of urgency, frequent urination, daytime or night. Often it's a sudden gush of urine. This can be idiopathic, which means there's no identifiable cause, and it's probably related to just nerves getting older and damaged from the multiple causes that we talked about, versus in a smaller percentage of women, it's neurogenic, which means it's caused by a neurologic disorder such as diabetes, MS, Parkinson's, any of the neurologic diseases really. So multiple treatment options are available for all types of incontinence. An important thing to understand is that we have surgical and non-surgical treatment options. So for stress incontinence, which is again that cough, sneeze, laugh, lift leakage, the simplest form of treatment is behavioral. So Kegel exercises or contracting pelvic floor muscles to strengthen them can be up to 70% effective. So pessaries are rubber devices that actually sit in the vagina, and for the purpose of incontinence, we would actually use one with a little knob to sit up against the bladder neck and provide support. So now moving to surgery. So the great news about surgery for stress incontinence is that over the years it's become less and less invasive to the point where now the gold standard treatment is just something called a sling. And this surgery, which used to be, a 3-hour procedure, a couple nights in the hospital, has now become a 20-minute outpatient procedure. These procedures are done under local, spinal, or general anesthesia. There is very minimal post-operative pain and a very low complication rate. So now let's shift gears and talk a little bit about pelvic organ prolapse. Pelvic organ prolapse results when we see damage to those support structures. Essentially what you get is a herniation of the pelvic organs into the vagina, and it can herniate so significantly that actually these organs can protrude out of the vaginal opening, and in some women they can come all the way out. So risk factors here, similar to incontinence: obesity, genetics, chronic heavy lifting and or straining, pregnancy, and childbirth. So again, let's go from least invasive to most invasive, because like incontinence, prolapse has both surgical and non-surgical treatment options.